Dr. Joel Gator Warsh is a board certified pediatrician in Los Angeles, California, who specializes in parenting, wellness, and integrative medicine. He completed his master's degree in epidemiology before earning his medical degree from Thomas Jefferson Medical College and pediatric medicine training at Children's Hospital of Los Angeles. Dr. Gator has published research in peer reviewed journals on topics including childhood injuries, obesity, and physical activity, and has been featured in numerous documentaries, films, summits, podcasts, and articles. Dr. Gator is the author of the new book, Parenting at Your Child's Pace, a guidebook for the first 3 years that balances science and natural wellness. He operates a private practice in Studio City, California, and offers parenting tips on his popular Instagram at Dr. Joel Gator. Hi, Dr. Joel, or do I call you Dr. Gator?
Either one's fine. I get a lot of both, so whatever works.
Thank you so much for your time. So I wanted to ask you about something from your book, which is your Dr. Gator smoothie. And hint, it's not an actual smoothie, but you talk about mental health support being one of the keys to a balanced integrative approach to health and wellness for kids. So how do you think mental health impacts physical health?
Yeah, I think it's so important, and we unfortunately just don't talk about mental health enough. But I mean, even just from stepping back, we are not talking about health in general nearly enough. I mean, we have a chronic health disease epidemic, especially in our kids. We have a mental health epidemic. Almost 50% of kids have a chronic disease at this point. Maybe about half of kids or teenagers have a mental health diagnosis at this point by the time they're 18. Like, this is not okay. And that's one of the reasons why I even wrote the book in the first place, was really to try to get ahead of some of this. And that's what the Dr. Gator smoothie is. You know, you watch on like the daytime talk shows, it's like the magical smoothie that cures everything. And there's no such thing, right? The realistic magical smoothie is talking about our foundations of health. And I call it the seeds of health: stress, environment and toxins, exercise, diet, and sleep. And then we're throwing in, mental health and nature and getting sunlight and family time and community. Like, these are the things that are really important. And so that's where the Dr. Gator smoothie comes from. And I think that it is so important that we also talk about mental health. We kind of separate things in medicine. It's really crazy how we do that. I mean, it's good that we have specialists, right? But the brain is part of your body. It's not different. It's not separate. And we need to give it as much focus as we do on everything else. And so, yeah, I think it's connected beyond the ways that we think about it. And I think it's so important that we discuss it and focus on it for our kids.
Yeah, that's so true. You're starting to see it a little bit more in like what I guess we would call Western medicine, right? Where they're starting to cover more alternative therapies and things like that. But you're like you said, I think we still have like a long way to go to truly kind of understand the connections, because we talk about this all the time, and we've interviewed other doctors that have talked about, including the president of the American Academy of Pediatrics, that these things are connected. But I think to your point, these are really coming to the forefront now that we're having all these epidemics kind of rearing their head nowadays. So
Right, exactly.
yeah,
We're talking about it more because it's such a big problem, but
yeah,
that's not okay. Like that's not the
right,
right way to do it. We need to get ahead of this. We need to prevent this. We don't want it to be this bad. And I think that's why. I mean, it's good that we're talking about it more, absolutely. But
yeah,
the reason why we're talking about it is because it's so bad, I think, and
yeah.
that's where we need to really see a shift so we can move it into a better direction.
Yeah. Yeah. Okay. Well, let's push on this topic just a little bit more. So, according to the Surgeon General's 2023 advisory on social media and youth mental health, so I'm going to jump to tech a little bit here. Depression and anxiety in kids and adolescents has reached its highest point in history. So you mentioned that already. So this is depression and anxiety specifically. So that doubled during the pandemic, and now 25% of youth experience depression, 20% experience anxiety. So I know you talk about mindfulness quite a bit. So how can families practice mindfulness to help improve mental and physical health?
Yeah, great question, and absolutely. I mean, it's such a huge statistic. I mean, it's crazy when you say those numbers, right? It's like
Yeah.
20%, 10%, 5%, whatever it is. It's way too high. I mean, of course, it's always going to be around, but those numbers are staggering. And I believe the first step in all of this is even just acknowledging this in the first place. I think parents are not aware that it's this high. And I think that's so important to be aware of it, so that way we can be more mindful of this as an issue, and really check in with our kids and make sure that we're being supportive and being present. Because a lot of mindfulness is not, sitting around a room and singing kumbaya. Like, a lot of times people think of the word as like maybe woo woo or out there, but it's really not. It's really about just being present and spending the time to really focus on what we're thinking, how we're thinking. And that may just be having conversations with our kids about how they're doing it. Sometimes just being open and having conversations opens the door for them to speak to us about the things that are bothering them. That might mean working with a professional like a therapist, who can offer strategies. I think we just need to be more aware in general. This is going on and is so frequent that we can provide the resources for our kids. And then, there are a lot of different ways to practice mindfulness. There's a lot of great apps out there. There's a lot of great programs out there. There's a lot of great books. It's really, again, just about being aware of your
Yeah.
situation, aware of your body, aware of your thoughts. And sometimes those words push people away because it seems like it's a little bit out there, different, or maybe we didn't do it when we were younger. But given where we are, and given the statistics, and given the mental health crisis, really, I mean, if you're talking about one in four, 1 in 5 kids having these kind of issues, then we can't assume it's not going to be our family. And I think getting ahead of it is really the key. And as they're growing up, even before this becomes an issue, really integrating some of this stuff into our lives and talking about it and getting ahead of it, I think that's really the key to moving forward to prevent this from happening.
Yeah. And you talked a lot about awareness, which is huge. Like, that's a big part of what we're trying to do. Is really, we're not saying don't use technology, it's bad, whatever, but we're saying, hey, be aware that this is maybe what it might be doing to your brain or doing to your body. And that's kind of the first step to going coming up with solutions, basically. So it sounds like you're mirroring that, which I love. And then I know your book is focused on early childhood, 0 to 3, but don't you think even very early on parents can start by just like acknowledging feelings, things like that?
Mm-hmm. Yeah, I mean, when I talk or practice, of course, I talk about all kids and all ages. But for the book, I focus more on the 0 to 3, just because I want to get ahead of things, and I want to talk about it from day one so we can set good foundations. But yeah, I think this is key to set as a foundation from day one. Our health matters, our mental health matters, and we, in general, don't prioritize our health anymore. Certainly not in Western society. We value, or have valued over the last few decades, faster and cheaper and easier. But what you lose with a lot of that is health. And I think we need to very mindfully bring back health into our conscious and into our decision making, and make at least some of our decisions based on health and not just money, or not just time, or obviously these things are factors, they're important, but I think that this has to be part of the equation again. And it's much easier to do it from day one than to bring it in later. You can bring it in later, you absolutely can. You can be 70 years old and change the way that you do things, right? That's never too late. But ideally, we're exposing our kids to some of this stuff early, exposing them to yoga, exposing them to mindfulness, exposing them to feelings, like talking about these things, being aware of it. That to me is the better approach to this. Just like when we're talking about food, you
Yeah.
want to have a good, healthy eating child. It's much easier to expose them to healthy food early, give them a variety of foods, talk to them about foods, bring them with you, than to do it later. If you expose them to the sugary, crappy snacks, then that's what they're going to want. And yes, you can make those changes, but it's of course much harder to do it. And you're already getting the damage being done over those years, as opposed to, all right, well, we're going to do things differently. We're going to, maybe I ate some of these snacks when I was younger, but we know how bad they are for us now. So maybe we're just not going to do that. And we're going to model it ourselves. Like, you can't expect your kid not to eat an Oreo if you do. You
Yeah.
have to do it too. And mindfulness just might mean going for walks in nature, right? And maybe that just means every weekend you're going to go with your family and with your 3-year-old, and you're going to go outside and you're going to go for a walk, and you're going to do that consciously. You're going to build it into your schedule. You're not like, again, woo-wooey, like going out in a campground and doing whatever. It's like you're going for a walk, you're thinking about nature, you're talking about things like that. That is mindfulness, and that is something that everybody can do. Like we can do those things and it doesn't have to feel weird or awkward. We're just building health.
Yeah, I think you're right. I think we almost need to rebrand the word mindfulness because it can be so much bigger and broader and, um, less alternative, quote unquote, right, than
Mm-hmm.
what maybe it used to mean. So those are all really good suggestions and so true. So let's zoom out to kind of parenting in general. I know you work with a lot of parents in your practice, and then, through like your Instagram, ironically, you're giving so many good tips. So let's talk about parenting sentiment. Two-thirds of parents say parenting is harder today than it was 20 years ago. And many are citing technologies like social media or smartphones as a reason. In August of 2024, the Surgeon General's latest advisory stated that parental stress is a significant public health issue. So, what do you think has changed in recent years that makes parenting so hard?
Yeah, that's a great question. And for me, when I wrote the book, you hit on the two things. Like the number one thing that I wanted to write the book about was health, right? And I think that was really important. There's not a lot of parenting books that also focus on health because most parenting books are written by therapists. But the second big reason why I wanted to write the book was parenting stress. I felt like parenting stress is higher than ever, even just in my career. I feel like parents don't trust themselves anymore. They don't trust their inner voice. They don't trust their gut. And so that was one of the big reasons why I wanted to do this, was to help to empower parents to trust themselves again. And I think one of the big reasons is social media. It is the internet. It's very hard to know what to do about anything anymore because there's so many competing opinions on every little decision, and those little decisions seem like they're big decisions when most of the time they're not. I mean, it's if you went back 50 years ago or 100 years ago and you wanted to make a decision on something as a parent, like, oh, well, what am I going to feed my child first and at what age? You asked grandma, but what did we do? Oh, you had peas and carrots when you were 6 months. All right, let's do that. Like, and that's not always going to be the best answer, but it's much more simple. You don't need to go read a book or whatever. You just kind of ask the people around you, and you did that in general, and that was fine. But now you get grandma's opinion, and you get the social media influencers' opinion, and you get Google's opinion, and sometimes you're like, oh, we did carrots, and then the internet tells you, well, carrots are the worst thing you could ever do for your child. If you give your kid carrots, they're never going to get to Harvard, and it's like this is the stuff that we see, and everything seems like such a big decision when most of the time it doesn't really matter, and people have their opinions, but at the end of the day, most things are actually okay. And a lot of what I really try to do is to help parents to not never Google, right? I don't think that's reasonable, and then not to shun all technology, but I do think we need to understand the way that the internet works and social media works and Google works, and that everything is oftentimes trying to grab our attention, headline grabbing. It's can be divisive, and it's not always the best information for you. So we have to know what's out there. I think get the information that's good, and then synthesize it and figure out what we feel like is going to be the best for us and our family, and then to try that. It's very rare that there's just one right way to do things, and I believe that we have to get back to gathering some information, synthesizing, and then just trying it, because most of parenting is not about knowing what exactly to do, because there isn't one right exact thing to do in almost any situation. It's just
Yeah.
about figuring out what's best that you think is best and then trying that. And there's no better example of that than if you have multiple kids, right? Because whatever worked for the first one half the time doesn't work for the second one. You have a good sleeper, bad sleeper, you're like, oh, I'm going to start at 6 months feeding, and then your second kid is a terrible eater and doesn't want to do it. So there isn't one way to do anything, and that's where it's like you have to get all the information about potty training, learn about the 6 different ways, and then, well, I feel like my kid's ready, okay, I'll do this. My second kid, oh, well, it's 2 years, they're not still ready, well, I'll do it at 3 then. Like that is how we can get back to trusting ourselves and decrease that stress, because right now parents are more stressed than ever. I think that's true.
Yeah, it absolutely is. And even though we focus on tech for sure and mental health, even we say all the time we would never blame tech for all of it. There's much more bigger societal issues taking place. You can talk about childcare, lack of childcare. You could talk about how, we used to have bigger communities raising kids. We can talk about how activities have increased exponentially for kids. Like
Mm-hmm.
society has changed as well. But I agree with you that social media is huge, not only Do you feel the comparison trap as a parent, right? Like, you might be doing great, but then when you start comparing yourselves to everybody else putting their best parenting life out there, that's really
Hmm.
hard. You covered things like conflicting information. That's very hard. And then when your kids get older, we haven't even covered this yet, but now you're managing your kids' tech use,
Hmm.
right?
Oh yeah.
And everything that comes with that. So it's definitely, I mean, everybody agrees it's a big contributor. How much, we don't know. But I love that you focused on the information part of it because I can relate. I am that parent that reads all the books, looks everything up. I try really hard to be objective. And, I'm a social media marketer since 2007. So I know what these platforms are doing. But even I find myself feeling like a terrible parent because, you go on and, everybody's posting their best life. And, oh, I made these things from scratch with my kids and I fed them the most amazing things. And obviously they're not putting the tantrums and the, day you had the Doritos or whatever on there. They're going to put the best stuff. So even I found myself in that comparison trap.
Yeah,
So I'm really
and I want
glad
to
you
add
focused
that
on that. Yeah.
I couldn't agree more. I mean, the list that you just went through before you, like, of all the different things, like I think that's such a great list of the many stressors that are available to parents these are available, I guess, that are occurring for parents
Yeah.
these days, and there's just so much to think about. But at least for me, like the reason why I went to tech, well, first of all, we were talking about it, but second of all, it's actually something that we have a lot of control over and that we can actually change. A lot of the things you mentioned are much more difficult to change. I think they're important, and I think they're big discussions that we must have to really focus on helping parents in the long run, because there are big problems in society in terms of supporting parents, supporting moms breastfeeding, supporting parents to be able to be home, supporting
Yeah.
parents able to afford childcare. I mean, all these things are super big and important, but not as easy to change in the short term. But tech use is, you can choose what you do on your phone. You don't have to
Yeah.
have it on, or you can choose what you Google. And so I do a lot of times try to focus on the actual solutions that we can focus on for today. But not to minimize any of the things that you said, because I think those are extremely important too, especially when it comes to the stresses of having two parent working homes or single
Yeah.
parent working homes. I think that's just not something that a lot of families had to deal with 50 or 100 years ago. Most families had one person working, the other person was home.
Yep.
Families were more traditional back then, and so that was just a different time. But with this time, it brings new pressures, especially for those that maybe don't want to work but feel like they have to, or their financial strains, or whatever it is. I mean, we're just in a different time that's really not very supportive to parents at all, with anything. And it's really just not a focus of our society right now, and that makes it really tough to be a parent, because you feel like you're being pulled in every direction and you're doing nothing well. You're like, well, I feel like I need to make money to
Yeah.
afford food, so I'm going to do that, but then I'm not home with my kids, so then I feel bad about that. And now I'm home cooking a meal for my kids, but I'm not working, so I feel like I need to make, like, it's like you're always doing something that's not good enough.
Yeah.
And so you never feel like you're doing the right thing, and that's tough. I think that's a really hard place to be, and yeah, that's why I think parents feel like they're struggling.
Yeah. That's so true. Okay, well let's talk about children's health again and kind of circle back to tech too. So this was from the 2023 Mott National Poll on Children's Health. So again, mental health and modern screen technology dominated the top 6 positions for parental concerns. So parents are worried about this. So, and this surpasses traditional health concerns like diet, smoking, vaping, even gun violence. So this is at the top of every parent's mind. So I know we covered this a little bit, but are parents right to worry about these issues?
Yeah, no, I mean, definitely think parents are right to worry about those issues. I don't think it should be higher than a lot of the other things you mentioned. I
Yeah.
mean, I think they're equivalent, but it should be on that top list of top five
Yeah.
things. I would put like healthy eating, food, exercise, nutrition and health all on that same level, because these things are all interrelated, and just as important. But one of the big factors, especially as the kids are getting older, is screen time.
Yeah.
The average kid is on like 7 to 9 hours of screens a day. And that's
Yeah.
insane. It's insane that they're on that much, because you have to ask yourself, okay, well, what are they not doing? They're not
Yeah.
outside. They're not playing. They're not cooking. They're not with their friends and family. They're on a screen. And it's not the screen that's the problem.
Yeah.
It's what they're not doing and what they are doing on the screens, in terms of like whether we're on social media, whether we're getting stressed, whether we're playing video games all day. And you can do your homework. That's fine. You can learn something on the screen. You absolutely can. I mean, there's a lot of good programs out there, but we're way past the point, I think, where it's reasonable or where it's healthy. And we have to dial that back, and we have to set boundaries, because clearly what we're doing is not working.
Yeah.
And especially when we have a health epidemic, being on a screen for 7 hours a day means you're not moving.
Yeah.
And we have to be moving consistently. And if we're not, then we're getting sick. We're not detoxifying. We're not sweating. I mean, these are things that are vital to our health, and we're doing the opposite. I mean, we're already in a world that doesn't promote movement, because we have technology and cars and everything that we never used to have, so we don't have to
Right.
move. And then we add on technology, which keeps us more sedentary. It's like a double hit of a negative, and it's just too much. I mean, that's why kids are sick. I think it's a huge issue. And when we're talking about mental health specifically, I mean, you know this, I'm sure you've talked about it before, but almost every study shows that exercise outperforms medication,
Yeah.
for our mental health, for anxiety, for depression, and that's just a key vital piece of information to know. It doesn't mean that medication can't be helpful. It doesn't mean that there aren't serious situations where it's unreasonable to do a medication, or you should do exercise first. But every child needs to be exercising. Certainly, those kids that are anxious, depressed, sad. We have to focus on that as part of the treatment plan too. But the goal, again, is not to treat, it's to prevent. And certainly some of what we're seeing is because our bodies are unhealthy, which leads to more stress, more anxiety, more depression. And if our kids had a higher baseline of exercise, I think those numbers would be somewhat lower.
Yeah. I'm so glad you focused on opportunity cost, which is what we're talking about, right? Which is because we're spending so much time on screens, what are we not doing? That is so important. And we even tell parents, like, I almost hate the word screen time, because it's, you touched on it too. It's like, what are you doing on there? Are you doing your math homework? Or are you scrolling TikTok? Like, those are two very different things when it comes to mental health, but also physical health too, because you know, social media just keeps you on exponentially longer. Like you talked about 7 to 9 hours. That is, you're right. That is the current statistic for American teens. 5 of those are social media, right? So it's
Mm-hmm.
taking up so much of that time, which is already very high, because these algorithms are designed to keep you on as long as possible, right? So, but I'm glad you focused on the what are they not doing, because that is a huge part of the puzzle. And when kids get older, there's, you talk about things like burnout, which is another issue. And again, it's that opportunity cost. Like when you're spending so much time managing your digital life, like, yeah, there's no time for homework or studying or after school activities. Or so if we just look at it that way, I think that's something that parents can very logically understand without getting into all the mechanics, which can be more complicated. So I know we said we're not going to talk about screen time, but I'm going to ask you about it. So there is not one clear standard, but every parent asks about it, especially the younger ones. But there are screen time guidelines set by several health organizations. So World Health Organization, American Academy of Pediatrics, American Academy of Child and Adolescent Psychiatry are kind of the main ones. So they all agree no screen time except video calls before age 2, and limiting time beginning at age 2. So, and again, I know that your book is focused on these youngest kids, and I agree that we need to start talking about these habits early on. So, what are your recommendations to parents?
So I don't 100% agree with the recommendations for the little kids, because I feel like it provides a lot of stress for parents that they don't actually need. I think it's very reasonable to minimize screen time. I think that's absolutely true. But saying zero screen time is very tough, because we live in a world where screens are everywhere. And it is not that uncommon that a parent will message me or come in and talk about how concerned they are that they saw their 6-month-old was watching TV for a couple of minutes because their toddler had it on and they didn't really realize, and they had turned their head and they were watching it, and now they're very stressed that they've like turned their child's brain to mush, or they've done something wrong, and that is just not the case. Watching a screen doesn't turn your brain to mush. It's again like what you're not doing. That's the issue. So if they're watching for a few minutes, that's not my concern. It's if they're watching it for hours, if you're plopping them in front of the TV, if you're assuming that they're going to learn, school from the TV as opposed to actually from a person, then that's where we're making our mistake, because research shows you can learn from a screen. You absolutely can. I mean, Sesame Street, there's lots of research from a few years ago or a few decades ago that talks about how you can learn from like something like Sesame Street, and you actually learn pretty well. But you don't learn as well as a person. Like, that's what we know. You don't learn as well as a direct communication and the back and forth. And so we cannot plop our kids in front of the screens and hope that they're learning. So to me, it's minimizing at that young age as much as possible, as much interaction as possible. Zero, it doesn't have to be zero, but it's just minimal. If it's a couple minutes here or there, that's fine. If there's something that, as your kid's getting a little older, 2, 3, and as opposed to them having a tantrum, they're watching a screen for a couple minutes. Okay, if you're out at a dinner or something and it's the end of the dinner and you want to throw it on for 5 minutes, that's not the end of the world. You need to go to the bathroom. I don't think that's the end of the world. If you're traveling somewhere on a plane, and you want them to watch an educational program, that's not what I'm concerned about. If you want to do zero screen time, I think that's fine, but I don't think we need to be so hardcore about it. I would just use it as a treat or something special, for those occasions where it might be helpful to kind of get through those few minutes. And then as they get older, we need to focus on what we talked about before, which is bringing down the 7 to 9 hours, not worrying about never being on screens or what's the exact time, but like, let's bring it down. Let's get focused on getting them doing other things. Let's try to minimize it to like 2 hours a day, 1 hour a day, or maybe you break up the screen time into 2 different categories. That would be like my recommendation, just like you said, school and everything else. So schoolwork, you do whatever you need to do for school. You're on your computer for whatever you need to do, and that doesn't count to me. I mean, it counts, but it doesn't. That's not what I'm worried about. It's all the other stuff, the social media, the video games. Like, that's where I would probably create some sort of boundaries around it, and that would probably be like a max of 1 hour, 2 hours a day. I don't think you need more than that on your screens on any given day. That's still a lot of hours per week, and then there's still all the other time that you're on your screens in general. So to me, that the most realistic way to move forward is to break it up and to make some reasonable boundaries around that, because screens aren't going anywhere. So we can pretend like they are. We're gonna say zero screen time, but that's not realistic, and that's not part of the world. They're here. So I just think we need to put some real boundaries on our kids and get the screens out of their room so that they're not on their phone all night. Their phone's not going to be by their head when they're sleeping. And maybe not first thing in the morning, and maybe you have some times during the day where you have family time but no screens, like dinner. I think all those things are reasonable suggestions that most people can actually do, and that will hopefully decrease the screen time by a couple of hours, and that's a good trajectory to go on.
Yeah, those are great suggestions. And just to be clear for the little kids, because this has been one of those areas that's widely studied in terms of the developmental delays, from what I understand, it has mostly to do with how many words they're not hearing, right? And not getting that direct feedback, the nonverbal cues, the emotion, the faces from parents, right? So, um, am I correct on
Right.
that?
So that is what I have heard and learned, and that's where I say, from what I have read, you can still learn from a screen. You just don't learn as well. And so if you're
Yeah,
learning a lot from a screen, then you're not getting those words, you're not getting the communication, the back and forth that you get from a person. And so if you were to just learn from a screen, you wouldn't learn very well.
yeah,
But if a child, but it's not so much a negative, right? Like, I think people think like, oh, you watch the screen, it's going to turn their brain too much. That's not what I'm worried about. It's that they're not learning from a person. If you
yeah,
have a couple of minutes in front of a screen versus them having a tantrum, I don't know which one's better or worse. Like, I don't think that's a negative. If
yeah,
you so that's where it is. So I agree. I think exactly what you said is the way that I think about it, and it's
yeah.
just that you're not getting that active learning, so they don't learn as well.
Right. And I think you made an important distinction, which is don't freak out if it's a few minutes here or there, but we don't want them sitting there for, 30, 60, couple hours, which is sometimes what's happening with
Mhm.
these
Right.
younger kids. So,
Especially with the younger kids, they don't have that kind of attention span, nor should
well,
they.
that too. Yeah.
Yeah.
Yeah. Okay. Well, let's talk about sleep a little bit because I know you talk about sleep a lot. And this is where a lot of these issues we've been talking about connect mental health, screen time,
Mhm.
everything. So there's been about over 60 studies that say that screen time among children and adolescents leads to delayed bedtime and shorter total sleep time. So, again, you talk about this in your book as well and on your Instagram. So, can you explain to people why do kids need sleep and how can parents make sure screen time doesn't interfere with quality sleep? You talked about things like screens out of bedrooms, but maybe we can elaborate on this a little bit.
Yeah, well, I think as a general concept, we still don't totally understand sleep. I mean, it's such an interesting concept that humans have to kind of shut off for this period of time every night. But we know that we do because we know that if you don't get sleep, you are in pretty rough shape very quickly. I mean, it's tied to our immune system for sure. People that don't sleep the recommended hours, the lower the amount of sleep, the more risk you are to get sick. There have been plenty of studies that show that if you're not sleeping even for a night or two, then you're at the same level as being drunk, right? So it just
Yeah.
affects your mental capacity, affects everything that you do. So it's really about resting and recovering, detoxifying. We know that we do a lot of that during while we're sleeping, we're growing. But really, detoxification is kind of the big thing that we're doing. So
Mhm.
it's just such a vital part of our lives, and we absolutely have to do it to refresh and reset for the next day. And it's often overlooked. I mean, especially when you're talking about kids and teenagers, and now with the screens, like we mentioned, it's just such an easy thing to be on your screen for hours at a time, and then your sleep um, gets affected by that because you're either stressed out, so you're not sleeping, or you're just on your screen instead of sleeping,
Yeah.
and then that affects your next day. And of course, if you don't sleep, it's going to be much harder to pay attention in school, focus in school, get your homework done, or do anything that all of us are doing, whether it's a kid or an adult. And so it's just an important part of our day that we need to prioritize, and parents must set boundaries around that. And we really need to make sure that our kids are going to sleep at an appropriate time, getting there, depends on their age, but 8 to 10, 12 hours, whatever it is. And that's important to set up a good routine. And that usually is the big thing that makes the difference, is having a routine, doing something similar every night, winding down, and getting screens away from our eyes, within an hour of going to sleep as best as we can, because we know that affects the melatonin, it affects your sleep, and that's not controversial anymore. That's well known. So, but our teens don't think about those things. They
Yeah.
they think about what's going on social media, or what they're going to miss, or what their friends are doing. And so I think if you just make the policy, then that's fine. Maybe in the long run, our country will change some of the policies. There are a lot of countries, or several countries around the world, that don't let you on social media after 10 p.m.
Yeah.
And I actually think that probably is a good thing that we should do for younger kids, because a lot of it's about fear about missing out. And so
Yeah.
if everybody's on the same playing field, and I think that's okay. And we're moving towards getting a lot of the screen time out of schools, which again, I think is good. I think that, for safety reasons, it's not unreasonable to have a phone, but you don't need to be on social media in the middle of the day at school. So I think that it's just, these are distractions that are there, and if we remove the distractions, then most kids will be fine with it, because we all were. And it doesn't mean we have to get rid of all social media, but I think we can set some reasonable boundaries to keep kids a little safer, keep our mental health a little bit stronger, and let kids focus on what's in front of them instead of what's on the screen. And if you do that throughout the day, then at least they're on their screen for 3 hours instead of 7. And that's a big difference.
Yeah. I'm glad that you touched on putting them away an hour before bedtime. That's huge. Depending on what you look at, it says 1 to 2 hours. 2 hours is tough. One, I think, is manageable. So that's really key. And then earlier you brought this up too, which was getting them out of the bedroom. So charging it in another room, you said kind of getting it away from your head, but not only will that help with sleep, but it also there are studies that also show just the presence of a phone is distracting. So if you know you can get to it to get on your social media and you're having FOMO or all the things that we've covered, it's very, very hard for adolescents to stop themselves. But if you have that barrier of it charging in a different room, some of our experts have said things like charge all your devices in the master bathroom. Things like that can really
Mhm.
help make a difference and protect sleep. So
Yeah.
it's the blue light, which is
Mhm.
important, but it's also the stimulation. And so you touched on this as well. So
Right, right.
both of those can
If
interfere.
it's there, then you're more likely to look at it, right? Especially
Yeah,
if something is worrying you or you're hoping that you like. If it's not there, then it's just out of your mind and you won't go to it. And
exactly.
then there's a whole other conversation for another day about Wi-Fi and Bluetooth and all of these signals and how they really truly are affecting us. And we really don't know at this point,
Yeah,
And I think that the stronger our phones get, the more technology we have, the more that things change, and the more I'm going to be concerned that this is affecting us. It probably is affecting us. How badly? Who knows? But
yeah,
if you're sleeping beside a Wi-Fi modem, router, modem, your phone for beside you for hours and hours a day. I mean, we're all made of energy, right? We're all made of
yeah,
cells and energy, and who knows how these things affect us? I mean, the moon, right? It affects the water, so maybe your phone does affect you a little bit, probably not a lot, but like a little bit and a little bit over 10, 20, 30 years. Who knows what that is going to do to us because we haven't had phones for that long.
yeah.
So I would say, just as a precaution, there's no harm in keeping your phone a little farther away from you when you're sleeping, because we may wake up one day in 10 years from now and be like, oh man, what were you thinking? Like, these are not good for you. These are increasing your risk of cancer. These are increasing whatever. I don't know. Who knows? We don't have
Yeah.
that kind of information yet. But to me, as a parent and someone who is a healthcare provider, like, this is a high risk thing to me.
Mhm.
And I feel like we're going to realize that it's doing more to us than we think. And certainly as it gets stronger and we've had it for longer, then it just increases your risk. So, to me,
Yeah.
it's, again, at the end of the day, like, what's the harm in having it somewhere else? There's no risk there.
Yeah, I'm glad you brought that up because parents have asked. We do a lot of parent eds, and one of the things that they ask is about the radiation. And um, I'm glad that you clarified that it hasn't been widely studied because it hasn't. And that's what I tell them. I did see very, very recently there was a study that said cell phones aren't linked to brain cancer specifically,
Mm-hmm.
right? But like you said, it's brand new. These devices, I mean, iPhone came out in 2007, right? And high speed video streaming, things like that, not till 2012. So we're talking about maybe 10 years. So
Right.
we're really right in the beginning of this. So like you said, maybe it will be studied. We'll know more about this. But I think your point about kind of taking that topic with a bit of caution is a good idea too.
Right. And
Um,
also, when you're talking about something like cancer, these things can take a long time to grow. So it'd be,
yeah,
maybe you won't notice that there's an increased risk of cancer for 30 years, or, maybe the phones weren't strong enough 10 years
right.
ago to cause the issues that they are now. And the issues, let's say like whatever, the latest, like 4G or something, maybe that is strong enough to cause a problem, but you need 5 years of that. So, we just don't know. And I'm not saying that it does. I'm just saying that we
Right.
just don't know. And so to me, there's theoretical risk there that doesn't need to be. If you just keep it away from you, then there's like a double good.
Yeah.
Worst case scenario, then it's all fine and good in 20 years and you don't think about it. But
Right.
what's the harm to get ahead of it?
Yeah. Yeah. I mean, thank you so much for being so balanced on that answer because it's really pragmatic what you're saying. Well, I thank you so much again for your time. And I just love your content, again, ironically, because I think there's just so many things there for parents. And then now your book too, to kind of help support them. And I think your work to me and just talking with you too, it has a very calming effect. Like you're definitely, you're not alarming people, you're kind of giving them practical tips for how to balance all this, and it's really really complicated. And parents are struggling, so thank you for the work you're doing to help support them.
Thank you. Thanks for everything that you're doing. Those are really good questions, good statistics, and really helpful, I think.
Awesome, thank you.